everyone. I am DeCarla Gothi, and my topic is physician assisted suicide. Let's start by defining what is physician assisted suicide. Well, it is when a doctor facilitates a patient's death by either providing them the means to do so or giving them the information to do so. And and an example of that would be a physician may prescribe sleeping pills for a patient, but also at the same time lets the patient know how much to take of those sleeping pills that could end their life. There is also a term that coincides with physician assisted suicide, which is euthanasia. Euthanasia is when a patient's death is caused by someone else, and this is actually illegal. Physician assisted suicide is legal in 5 states in the United States, and those states would be New Mexico, Vermont, California, the state of Washington, and Oregon, which Oregon was the first state to actually legalize physician assisted suicide back in 1997. And their terms were that a patient had to be in sound mind, have the mental capabilities of saying, I want to end my life, and also had to be able to do it themselves, had to take their lives themselves. The physician was not able to do that for them. They just provided the means for them to do so. And that's what's the difference between euthanasia and physician assisted suicide, which euthanasia is illegal in all 50 states. I'm sure you've heard of the infamous doctor, Dr. Jack Kevorkian. He was an advocate for physician assisted suicide. He actually, between 1997 and 1998, he assisted in over 130 assisted suicides. But he was also convicted of second-degree murder because he actually didn't allow the patient to take their own life. He gave the lethal dose that took the patient out, so they considered that as murder, and he was convicted of such and served 8 years in prison. But before then, back in 1990, he was the first one to actually initiate or to perform physician assisted suicide on a patient by the name of Janet Atkins, who was suffering from Alzheimer's disease and decided she no longer wanted to suffer with the debilitating disease and decided to end her life. And Dr. Jack Kevorkian provided her the means to do so with his death machine, that he called it. It was just similar to what the prisoners take when they go through death row and have to take the lethal injection. And the Dr. Kevorkian's death machine, the patient gave themselves potassium chloride, which would cause them to have a heart attack, and that would end their life. But physician assisted suicide can help in a couple of ways. One is it can help cut down the cost of health care. Just one chemo treatment is $50,000. And a patient sometimes has to decide on whether they want to, okay, can I pay for my medications, or can I pay my bills, or, how am I going to live and also live and per se, my life and through with all these numerous healthcare bills. It costs more to sustain someone's life that doesn't necessarily have the quality of life versus they may have the quantity and may prolong their life, but there's no quality. All their life is spent on being sick all the time, having to endure a lot of pain and suffering that's caused by these terminal illnesses and maybe severe disabilities that they're having to endure because of because of their illnesses. And they'd rather to end their life with dignity and on their own terms, and versus suffering and spending their last days, in pain, or just no life whatsoever, no quality of life. And they choose to have quality over quantity, and that's the main thing when it comes to physician assisted suicide. These patients want to die with dignity and have, quality of life, not necessarily quantity. which is the most important thing.